All right. My name is Vincenza Grappuzzo. I am the research coordinator at the Center on Aging, and I'm very pleased to welcome Andrew Sixsmith to our spring colloquium. Andrew Sixsmith is professor and director of the Gerontology Research Center at SFU. He's also deputy director of the SFU Interdisciplinary Research in the Mathematical and Computational Sciences. That's the IRMAC Center. He is president of the International Society for Gerontechnology for 2014-2016. He has worked in the area of technology, health, and aging for many years. His recent publications focus on the use of surveillance and monitoring technologies in long-term care and to investigate causes of falls. His research is within the area of health and quality of life of older people and the role of health and social care services. Recent work includes the development of management tools for health and social care performance evaluation and decision-making, and the links between the home environment and health and well-being outcomes. He is involved in the strategic development of research in the area of technology for independent living. Andrew has used gerontological knowledge, theories, and methods to provide input into user-centered design and development of community care technologies to facilitate and deliver health and social care services for older and people with disabilities. His current work explores the potential of ambient assistant living, intuitive interfaces, and smart environments to support independent living. Andrew is also one of the AgeWell Scientific Directors, recently funded Technology and Aging Network in Canada. And we are absolutely delighted that Dr. Sixsmith is here to join us. Thank you.
Okay, I'm going to apologize for being late. I always tell my students often. And also, the people in Vancouver blame Victoria for the bad weather this morning. They said, "Oh, we're late. We're cancelling the flight because it's bad weather in Victoria." That's what they said, and I don't believe that's true for 1 second. So what I want to do today is tell you about this exciting new development, which is called AgeWell, which I'm not sure whether people have heard of this. Has anybody heard of it? Yeah? Anybody not heard of it? Okay, quite a well, it is brand new, and it's a major development in the area of research and technology that the federal government has decided that this is a really useful area to invest quite a lot of money to really help with innovation in this sector over the next 5 years. So I basically wanted to tell you about this because there are a lot of opportunities, not just for the things that we've put in place right now, but opportunities will open up for more collaboration across Canada between researchers and service providers and with industry. So we're right at the start of this, so it's quite an exciting time to be able to tell you about it. So what are we doing? So increasingly, we're believing that technology is a potential solution to some of the challenges that we all know about within the field of technology and aging. Technology is providing new opportunities to deliver care more efficiently, while enabling increasing number of Ontarians. Now, this is from an Ontario policy document. You could put British Columbians in here equally as well, I think, to remain living independently at home. Advances in technology have and will continue to serve as enablers in meeting the evolving needs of an aging population. So it's increasingly being recognized as a potential thing that we can use to help older people to live independently. And there's a number of kind of trends which are coming together. So convergence of these key trends in Canada make it a really good time to be working in this field. And I do believe actually Canada can make a real impact on the world scene in research in this area because of the opportunities that are coming up right at this point in history. It's really quite interesting. So we all know as gerontologists about increasing numbers of older adults within the population, and that there are lots of age-related illnesses and conditions that are probably going to have an impact on demand for healthcare services. It's not such a straightforward, and when I teach a course on healthcare and aging, and this relationship between growing numbers of older people and demand for healthcare services is not as straightforward as we often assume. But certainly there are increasing numbers of older people within the population, and that's going to increase, and particularly in places like Canada, where there's relatively significant increase over the next few years. So a second factor here, seniors becoming more tech savvy. Younger older males are actually the biggest users of the internet. Whatever that might be for, I don't know. But they might have time on their hands and appear to be motivated. So the idea that older people are technophobic is an idea we should dispense with. Okay, a lot of older people are actually quite tech savvy, and I've connected with the White Rock Seniors Computing Society, apparently, which is, and I've met these guys, and these guys are typically people who've retired from the IT industry and are very interested in spreading the word about how IT can help, and they're very interested in connecting with the research that I'm doing, and particularly in how, for example, peer support groups could help people who are not particularly good at doing technology things, to help them connect with the kinds of computing and mobile devices use that we take for granted. Another trend, pervasive computing and the Internet of Things are now reality. Have people come across the concept of pervasive computing at all, or the Internet of Things? Some people have, probably some people haven't. But the idea that, you know, we're kind of in a generation of technology which is getting a lot more interactive, but typically we still use screens and buttons and keyboards and mouses to interact with the technology around us. But pervasive computing is where all this intelligence is embedded within the environment, and often we're not aware of it. This is where there are ethical things around this. I'm very interested in the sorts of surveillance technologies that are getting very, very ubiquitous nowadays. We're being watched all the time. Okay. For example, if you're on Facebook and you see adverts at the side of Facebook, and you wonder why. Oh, well, I've been really interested in this area so far, and Facebook have actually sent me adverts which are quite useful. That's because they're reading what you're doing. Okay. You may have come across some news in the last few days that if you've bought a smart TV recently, anybody? That TV might be listening to you, right? Because if you're using voice commands, those voice commands are sent elsewhere to be understood, and the command then comes back to the TV to control it. So you are being listened to in your home if you're using that kind of device. So that sounds a bit ominous, doesn't it? But the idea is that, well, actually, pervasive technology and connecting things together can be something which might be actually very helpful in our lives. Okay. Healthcare technologies are the next big thing with significant global investment. Nobody would have imagined 5 years ago that people would be running around with Fitbits and this, that, and the other. Or that you went to the iStore and you could buy all sorts of things which would measure your health. Whether that's, you can go into the iStore and buy things now for a few dollars, which literally would have cost tens of thousands of dollars just a few years ago. So this is an area which is massively growing at the moment. And if you look at any of the trade shows to do with home computing and mobile computing, this is a big area of development. So it's something that is taking off in its own right. And also there's an awareness both within Canada and by provincial and federal governments and across the world that we need new innovative solutions that are going to help older people to live independently. So Age Well, the vision of Age Well is to harness the potential of technology to provide high quality and sustainable services and solutions to meet the needs of current and future generations of older adults in Canada. Our vision includes the creation of capacity for Canada to establish its position as a global leader. So the federal government has invested quite a substantial amount of money to put together a network of centres of excellence across Canada, which is going to be focusing on harnessing research in this field to drive innovation. By innovation, we mean new products and services that older people can use, that service providers can use to deliver their services better, and also to generate opportunities for industry and for commercialization. So sometimes, I get into discussions with my colleagues, and there's a kind of a polarization in an opinion around whether we should be doing, as universities, we should be doing really strong scientific work. We shouldn't be doing all this applied stuff. I've never found a problem with combining both of those. And I think if we're in the area of gerontology, we're necessarily applied. We're interested in how we can use our knowledge to help people. It's not just about, sitting in our little ivory towers. Or if I'm in, I keep telling my colleagues on Burnaby Mountain that they are in one of SFU's ivory towers, and that they've got to get off the mountain and come down into the real world and get real. I think that we can do proper research which has both basic and applied value. An important part of this, and one of the challenges, and I'm going to be talking about this later, is that by definition, if we're going to make this happen, we're going to have to do it in a transdisciplinary way. Quite often, we've carried out research in this area in our little silos. So I'm interested in particular things, or a colleague of mine is interested in developing some device or piece of technology. But if we're going to make this happen, it's important that we do it by connecting together. I cannot do my work unless I'm connected to engineers, because I'm not an engineer. I kind of was years ago, but no longer. My skills in that area have completely gone. So in order for me to do my work, I do have to connect with engineers. And those engineers also need to be able to connect with, say, people in the field of business. Because if we're going to create useful products and services, they have to be taken out into the real world some way or other. So by definition, if this area is going to succeed, we need to develop a transdisciplinary approach to do that. So what's AgeWell looking like right now? AgeWell was officially announced by the federal government in December, and then we had Minister Alice Wong, Senior Minister Alice Wong, made an announcement about our specific network in January over in Toronto. So we have, at the moment, and this is the starting point, we have 96 network investigators and collaborators from 25 different universities and research centers across Canada. We have 26 industrial partners, 18 post-secondary partners, for example, Centers on Aging, many not-for-profit organizations, increasingly so in this area. We have 19 provincial partners, for example, Fraser Health, and 3 federal partners, for example, MyTax. Do people know about MyTax? MyTax. Okay. I'll probably tell you, MyTax is a really interesting opportunity. Okay? Because if you've got a connection with an industrial partner who's interested in you doing some work that's going to benefit them, then if you can get a contribution of, say, $10,000 from that industrial partner, MyTax will match it dollar for dollar. Okay, so it's a really, really good program which will leverage funds. It also expects the researcher, whether that's a master's student or a postdoc or a PhD student, to spend a certain proportion of the time actually working with the company concerned. So it's really about a strong academic industry partnership and providing the funds in place to make that happen. So MyTax is one of our partners, and we're very interested in using MyTax as a way of leveraging additional funding from the industrial partners that we already have in place. So some of the things that we want to do, as I mentioned before, we have to have a transdisciplinary approach. I'm a very collaborative researcher. As I said, I have to work with all sorts of people in order to make this happen. Over the past 15 years, we've seen a dramatic increase in Canadian research in technology and aging. However, this typically is done in silos, with little overlap and collaboration. And this lack of collaboration has hindered advancement into meaningful results and commercially available products. So this is one thing that we're really wanting to do. We also want to focus on real problems. Typically, in this area, researchers focused on technology development and issues of usability. However, this technology-driven approach creates a danger that resources are devoted to ill-conceived technologies and that these are irrelevant and inappropriate. So what we need to do is involve older people themselves, people who are actually experts in their situations, older people, their caregivers, to really understand what those problems are. And this is where I do believe gerontologists have absolutely a huge role to play in input into really understanding the problem area better than we do at the moment. So this is I do believe, an exciting opportunity for gerontologists. We also want to, on the other side of things, Okay, we talk about research with older people and caregivers. We also want to really have an impact in the real world. And part of this is that we need to improve Canada's global competitiveness. Not often something that, as researchers, we think about. But again, if we're going to have an impact in the real world, I do believe we need to take this seriously. Canada is actually lagging behind the rest of the world in respect to research output, building capacity and industry, and community receptors. And there's also evidence of significant policy gaps demonstrating a lack of appreciation as how can technology facilitate better services for older adults. Well, for example, one example of this is in British Columbia. It's actually very difficult for older people to access funding for assistive technologies. Irrespective of the evidence which suggests that for every dollar of preventative interventions you do, you probably will benefit several dollars in terms of savings to the emergency services or offsetting going into residential or nursing home care. So we also need to look at issues around policy development as well. And AgeWell is designed to ensure success through excellence of its researchers. And I do believe Canada and the researchers that we have within our network are really very well recognized across the world. But we need to we're getting in place more than just a network of researchers. The AgeWell network also has a dynamic and invested group of partners and stakeholders, and I've talked about some of those a little bit. We also have identified a range of projects that have market potential. And we also have a lot of things in place to promote innovation and capacity building. So as I said before, AgeWell will help Canadian seniors to remain in their homes and communities and support families and caregivers. And I think the really important part of what we're trying to achieve in AgeWell is to go away from this scenario where we're doing lots of research, where we're creating all sorts of interesting things, but these are not being followed through in terms of real products and services that are getting into the marketplace. And this is where we have to have these collaborative networks in place. And I'll talk a little bit about what that might look like in a few minutes. So why has AgeWell been set up? We've put together AgeWell, this network of centers of excellence, to connect knowledge and add strength to what is already being achieved in Canada. Okay? So we already have lots of good research in Canada. But what we're trying to do is put those together to create a critical mass that will combine to really push this area forward so that we can connect together. For example, if we've got particular expertise in one area in Canada and we've got resources in another area, we need to put those together so that they can work together in an effective way. We also want to train the leaders of tomorrow in this field of technology and aging. And one of my ambitions is that the people who are currently master's students and PhDs and postdocs in 5-10 years' time will be looking back on what we're doing right now saying, oh, well, how quaint that was, It sounded like a good idea, but, we've learned so much more in the last 5 or 10 years since we've been working in this field. That's really what I'm trying to do. We want to develop new products and practices and policies, and really to exploit this tremendous opportunity for successes and impact in Canada. So I've got a real passion for this, even though I'm not Canadian. Not right now, not, but maybe in a little while. And this collective impact is really important. We need to provide the necessary pieces that will put all this together. So long-term commitments by a group of important actors in different sectors who are engaged in a common agenda for solving specific social problems. And having this collective impact is that we need to make sure that we have a common agenda that everybody is working towards, that we have shared measurement systems. You know, a lot of the research that is done in this area is quite ad hoc and on small scale. Maybe we need to put these together to really show and demonstrate the impact, that we can mutually reinforce the activities that we're doing, that we're continually communicating. And the concept here is to build a research community, not just a collection of individual researchers. So these are just a few slides which show where we are in terms of connecting up. So here are some of our partners, some of the post-secondary institutions. As I said, we're right at the start here. What I'm trying to do is orientate people within AgeWell rather than talk too much about the nitty-gritty of the technology. And there are going to be lots of opportunities over the next 5 or 10 years, however long AgeWell exists, for us to develop new research collaborations. And indeed, one of the nice things that these sorts of trips allow me to do is to connect with people and to start these collaborations off. And this is something I'm going to be doing increasingly more over the next few years. So we have industrial partners ranging from large companies like IBM and BlackBerry to relatively small organizations, provincial partners, federal partners, NGOs, etc. So what are we actually doing within our research? What are the key features of the research that we're going to be doing? So as I mentioned, particularly involving end users and partners in developing a strategic plan for what we're doing. So we're not just using, we're not just going to say, I've got this great, as a researcher, I've got this great idea, I'm going to develop it. What we really need to do is collaborate with end users and our service provider partners to develop a strategic plan for our research. And we've been doing this over the last year or so. And we need to develop technologies to meet the needs of a diverse population of seniors. One of the interesting things as a gerontologist is that, you know, we talk about older people in general terms, but I think gerontologists are well aware just how heterogeneous the older population is. And we need to be aware of that diversity and to meet the needs of a very diverse group. Unfortunately, a lot of our solutions that we have in place right now don't really recognize that level of diversity, and we really need to appreciate that more and develop solutions that are going to really recognize that. We need to develop technologies with end users, industry, and community partners. And this actually requires us to do research in ways that typically we haven't done it in the past. I was actually surprised when I started speaking to my colleagues in computing science about this, that none of them had actually submitted an ethics application in their lives. Okay, because they've never done what we would describe as user research. Okay, and I was like, well, how can you develop something if you don't actually speak to somebody about what you're developing? Apparently they can. and they do. and that's one of the problems that we're up against. So I'm pushing my colleagues in areas like IT and computing science, mechatronics, information science, et cetera, to come down from Burnaby Mountain and SFU into SFU Surrey, which is a great people visited SFU Surrey at all. Yeah, it's actually in a shopping mall, right? I think that is a great place for an SFU talks about it being an engaged university. A great way to engage with the local community. So yeah, we need to speak to real people if we're going to develop things that are actually going to work in the real world, and we need to understand their experiences. Now that sounds great. It's actually a really difficult thing to do, and I don't know how long I've got, but I would like to talk about some of the methodologies that we might need to bring into place to do that. And again, where gerontologists can play a key part. So some of the things that we've been doing, we've had a number of things in place over the last year or so, which we've really used to generate our research agenda within Age Well. So we've collaborated with people in all the different stakeholder groups that I've mentioned, through things like webinars that we've put on. We also had things, you've come across the concept of Café Scientifique? Yeah. So we've had one of those in Toronto and in Vancouver. This is the one that we held, well, it was actually in Surrey. And this is a photograph of that. I'm there. And actually, the guy with the on the left is from the White Rock Seniors Computing Society. Okay, so yeah, we want to connect with people and really help people and help them to help us define the sorts of research we should be doing. As I mentioned, the seniors population is extremely diverse. We tend to, if I'm teaching Gero 101 or so, I've never taught Gero 100 course that we have at SFU. But one of the things that I do try to get over to people who are not really into the gerontological field is just how heterogeneous it is. And that really is something that within Age Well, part of the things that we have to do is educate the people who are in our so-called transdisciplinary network, okay? Because when I speak to engineers who are interested in this field, they see older people as, firstly, a problem. Older people have problems, and they are a problem. Okay, that's the thing. They also focus on symptoms. Yeah. Oh, yeah. Somebody's got this disability or this, that, and the other. So what comes out of that is a concept that we develop technologies that are kind of like a prosthetic arm. Technology is a prosthesis. It's an interesting model. It's a very useful model, but it's not the only model that we want to have in place. So the heterogeneity. We have active seniors. We have, in BC is one of the healthiest places in the planet, interestingly, with one of the most active populations, including seniors. Many seniors, in fact, most seniors, if we look at the stats, are independent, pretty healthy, and pretty active. And we need technologies in place that are going to help them to remain so. So, preventive agenda. But we do also have to recognize the variability, the diversity, and the problems that do exist. So, for example, people with cognitive impairments. We also need to recognize that older people do not exist on their own. They're part of a social network. We have to be aware that caregivers are actually the most important part of the support network that helps keep people together. But there are people who are isolated, who are facing different situations, and we need to be aware of that as well. People living with chronic disease. We also need to be aware, and particularly in a country as huge as Canada, the differences between the needs of people living in urban communities and those living in rural locations. So what are we doing within AgeWell? We have a set of overarching research questions. Firstly, what are the needs of older adults and caregivers? We know some of this. There are some things we don't know. So part of what we're going to be doing is assembling what we know and communicating that better within our network, but also carrying out research which is going to help us better understand the problem area and use that to generate new technological solutions. Which leads us on to question 2. What are the technology-based systems and services that need to be used? Okay, and I'll mention some of the things that we're going to be looking at in a little while. And then the third question, okay, we understand the problem. We develop technologies, but we then need to take it one step further. How can we foster innovation? And this is actually the crucial aspect of what we're trying to do. And these questions are addressed by a set of work packages. Sorry to use this awful sounding word, but a work package is a kind of an area of interest. You know, so if we have people who are interested in, say, robotics, then we put those together so they can work synergistically. So we have a number of work packages which are addressing these 3 questions. But we've also, particularly to address question 3, we've put in place what we call cross-cutting activities that work across all the networks, across the network and all the work packages. My colleagues don't like me saying this one, okay? This is aimed to help researchers in those areas that they do really badly at the moment, okay? And this is around, you know, researchers do research great, but when you think about things like knowledge mobilization and commercialization and communication, we tend not to do that very well at all. And I'm fully aware of that as a researcher. So we need to put in place the things that are going to help people to do this. So, for example, I've got 4 postdocs in my team right now. And I've told them that, okay, you're doing all this nice research. I actually want you to go out and form a company that will do something, okay? And that is going to exploit your skills. And they're going to have to go out and find and speak to people and find knowledge about how to do this. What is their market? What is the sort of service that they're going to provide, et cetera, et cetera. At the moment, they don't know how to do this. And that's the sort of thing that we need to get in place within AgeWell that is really going to drive this sort of area, so that people, say engineers particularly, who've got good ideas, that have got commercial potential, what do we need to do to put to get in place to help them do those sorts of activities? So some of the research that we're doing, we're looking at developing new knowledge about technology needs and preferences of older adults and new opportunities to support caregivers. For example, I mentioned the issues around the differences between urban and rural areas. Is that particularly we see communication technologies as helping to connect people in rural areas and to deliver services, keeping them informed, etc. You know, like basic information about health services is absolutely crucial to accessing those services. Unfortunately, many people live in in rural areas that are not particularly well connected. So there's basic things around, connectedness, which we need to understand. We have a number of areas where we're looking, sorry about these acronyms as well. They're not particularly important. But we're working in areas such as robotics and smart home systems that support older adults with cognitive tasks at home or in the community. Technologies that assist older adults with physical impairments and disabilities. The sorts of things that I mentioned before, you know, the design solutions that are going to help with particular things like mobility impairment, for example. So one group over at UBC have been doing a lot of work recently on smart wheelchairs to help people with cognitive impairments to use powered wheelchairs. Quite often people, say for example in nursing homes, who have mobility problems but also have cognitive problems, are no longer able to use their powered wheelchairs because it's dangerous. So can we use technology to make them safer and to help older people with cognitive impairments to still remain mobile, which is part of living independently. What we're trying to do with AgeWell is to take that concept to other things like scooters and stuff. And there's a lot of development in this field nowadays. But also we want to look at products that enable greater social interaction. I was chatting to Scott earlier about just how hard it is to use the video conferencing technologies that exist. Who's attended a video conference where you spend the first half an hour trying to get it working? Yeah, everybody's had that experience. I find it very difficult to understand why we're having that problem, yet it persists. And I'm guessing, you know, we're fairly tech savvy, we're fairly intelligent, problem-solving people, right? Yeah. How can we expect people who don't have the sort of skills we have to use these technologies? Okay, so we absolutely need to make things more usable. I was actually involved a few years ago in a nice little project, which we wanted to develop a simple music player for people with dementia, because we became very aware that older people with dementia actually like listening to music, okay, for various reasons. Yet there's a few problems around that. For example, if you have dementia, you might not remember that you like music, okay? And even if you do remember that you like music, you may not remember what sort of music that you like. And even if you remembered that, you then come to the music player and you can't use it anymore, okay, because it's too complicated. So there's a whole range of barriers that are in place which make it very difficult for many people to listen to music. Okay, so we designed a very nice little device that simply was an MP3 player that was mocked up to look like an old-time radio, small little thing. And all you had to do to listen to music was lift up a lid, and it played the music, and you shut it to turn it off. Okay? That is a commercially available product. I'm not in the business of selling it, but you can use it. It's proved quite popular. So we put a lot of time and effort into making things a lot simpler and easier to use, and I think that's a big lesson that we need to think about. There's other things which are more high-tech than that. For example, I'm quite interested in monitoring the cognitive status of older people. Some interesting things have come out of this area. For example, it's possible to monitor changes in people's mini mental state exam score, right, by indirect means. For example, you can map the way they move across the room, and depending on how people walk across a room, that's a pretty good indicator of their level of cognitive impairment. So it is possible to use fairly unobtrusive methods to get real-time measures of changes in cognitive, a person's cognitive abilities. The clinical application of this is really interesting. Most people in a nursing home supposed to get an assessment every 6 months, I believe. That's the requirement. Those sorts of assessments are done in some sort of clinical environment, and typically people try harder when they're having some kind of assessment. If we're able to look at changes in a person's cognitive status, we can get interventions much more quickly into place that are going to have a benefit. And also, for example, we're all aware that people with dementia have good days and bad days. Sometimes they're quite lucid, sometimes they're not so lucid. Imagine if we were able to really pick up on that and target interventions which are going to add to people's quality of life, because we're able to be much more responsive to their everyday needs. And then a final focus, which is on innovation. In areas such as developing policy, we need to improve the current policy, reimbursement, and regulatory landscape in Canada. There are actually barriers in place, and I mentioned the thing about reimbursement, which goes against a lot of the innovations that we're trying to achieve. Another example of this is the way money flows around healthcare systems. You know, if you save money in one area, it doesn't necessarily mean that money is going to benefit you. It might be in another sector. Typically, we keep people out of the emergency room, okay, if we put preventative measures in place, but the economic advantages are actually accruing to the emergency room, not to the people with the preventative things in place. So there's kind of a perverse disincentive there in many ways to put the sorts of things that we're interested in place. But we also need to be very careful about how we apply these technologies. For example, understanding the ethical and privacy and security factors that are involved in these sorts of technologies is absolutely crucial. People have to have confidence that these are going to be not only helpful, but that they're not going to have negative consequences. And how we implement technologies really has to be done in a very that needs to be done in a way that appreciates the complexity of everyday life. For example, the sorts of monitoring technologies I mentioned with for cognitive impairment, they are quite invasive. You know, so say, for example, you're going to install things which are going to monitor a person's movements in their own home. That has issues around privacy, but also maybe people heard of the Hawthorne Effect. Yeah, some people have. Probably some of you haven't. So the Hawthorne Effect: if you observe something, you fundamentally change what that thing is simply by observing it. And we have to be aware that if we monitor people in their homes, we do run the risk of changing what the nature of that home experience is. And I've come across many cases where in trials of these sorts of technologies where people have mentioned things about how they've changed their behavior because they know they're being observed. You know, if you're being observed, it has an impact on your everyday life. And we have to be very careful about that. So I think I'm going to finish very quickly. I just wanted to give you a more detailed flavor of some of the projects that we're doing. This is taken completely at random. So we're very interested in promoting social connectedness through new and innovative communication platforms. So this is going back to making things easier for people to use and to use the technologies that are commonly available in a way that is going to make them more accessible to the senior population. So we want to design, create, test, commercialize new communication technologies for seniors. So, for example, I'm working with a company in Vancouver called Claris, who are developing a simple tablet for people to use. And we also need to look at, well, do these technologies actually help to reduce social isolation, loneliness, and depression, and improve their cognitive functioning and health? What are the impacts of these technologies? So this is an important area where gerontologists can play a role. We need to demonstrate real-world effects and impact. There's no point in having these technologies in place unless they're going to have benefits. And we need to have the methods in place to demonstrate the efficacy of these kinds of interventions. And gerontologists have a lot of skills in this area, and this is another area that we can do a lot of work. And we need to develop these technologies using things which are low cost, robust, and readily available. Too many times, research in this area has kind of developed things which are going to be expensive. They're going to not be generally available within the population, et cetera, et cetera. So there's a lot of things now on the market which have started to make life a lot easier in this respect. So, for example, an iPhone. An iPhone has a platform in which lots of different apps can plug into. Okay? We already have a standard in place that allows us to do way more things than with mobile technologies than we could do just a few years ago. Equally, things like games consoles. Has anybody here got a Kinect? Yeah, yeah. And there's also the Wii console as well. These actually are quite powerful tools. The Kinect Sensor is something that costs, what, I'm guessing about $100. That is used very, very extensively within the research world. It's a sensor which 5 years ago, I think it came onto the market. 10 years ago, it was science fiction to think that we'd have something as powerful as a Kinect Sensor to do some of the pervasive computing that we're now starting to do. And these are low cost, they're robust, and it means that we can really take our ideas and put them into using platforms which are actually going to work in the real world. And just to finish off, just to mention the sorts of things that we're going to be doing within AgeWell, which are really aiming to increase the impact of what we're doing. So particularly in areas such as knowledge mobilization and commercialization. We're very interested in what we call transdisciplinary team working. This is an interesting area. You know, it sounds great. We're going to have a team of engineers, people from business schools, people from gerontology, et cetera, et cetera. How would you get all these guys to communicate together? To me, that is not a straightforward problem. It's a very, 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 very challenging problem indeed. So one of the things that we're interested in doing is, well, how do we turn gerontological knowledge into knowledge that is usable within the wider community? So, for example, if we do research in say, understanding the needs of people with cognitive impairments, how do we put that in a form that an engineer is going to be familiar with and comfortable with? And I personally was in a project several years ago where we were developing some planning tools for people in the care industry to analyze cost benefits and things like that. And we spent a lot of time trying to say what we wanted to do to our IT people, and they just could not understand what we wanted. They couldn't get it right. So what we did is that we actually trained the gerontology people, the people with the domain expertise, in some of the high-level system design languages that the IT people were familiar with, and that worked very effectively. And it didn't require us to learn, something particularly sophisticated, but it made us think in a different way to what we usually do. We had to be a lot more specific about, when we talked about things like cognitive impairment, we had to be a lot more specific about what that actually meant in the real world if we were going to create systems that were going to be appropriate. So it involved us in learning some new skills and thinking about things in a different way. And I think that's one of the areas, and we're going down to what we call CC4 train here. This is the training and the mentoring of HQPs, highly qualified personnel. The people like PhD students, master's students, postdocs in universities, but also people working in industry and service provision who are interested in this field. Training them in the sorts of skills which are going to help to make this sector develop. And actually, this is a crucial part of what we're going to be doing within AgeWell, is providing this training in areas such as commercialization and team working, which are actually going to help to build capacity within our research community in Canada. So I will finish there. Thank you.
Yep. Andrew, thank you so much. We all look forward to being engaged in the AgeWell network, and I know many of us are going to be meeting with you today and tomorrow. You're going to have lunch with several of our students here, and they'll be talking a bit about professional development as well as some other aspects of your work and your network. I wonder if you might just say a word about the conference you're going to be hosting in Vancouver in a few months on aging and technology. It's something we also might be quite interested in.
Okay, that question's a bit left field for me because I'm technically in charge of that, right? But Gloria Gutman is the person who is actually in charge of putting that conference. I'm sure many of you know Gloria. She's an epic conference organizer. So it's actually going to be one of the first AgeWell branded events. I'm sorry to talk in these kind of commercial things all the time, but it's something that AgeWell is very interested in doing is to communicate to the wider world about about what we're doing and where we're going. So we've got a conference which is part of SFU's Friesen series of conferences, which we hold every year, and that's going to be in May at the Harbour Centre. So if people want to come to that, it should be a good event. And this is, I think, going to bring, and the aim of the conference is really part of it is to presentations and discussion, but a lot of it is to do with connecting people and communication as well. So a lot of industry partners, a lot of our service providing partners are going to be there as well. I think it's a good opportunity to start engaging with the AgeWell network.
Again, thank you so much. We're going to need to wrap up right now, but if some of you would like some time with Andrew, he'll be back on campus tomorrow morning, ending with lunch before he heads back to Vancouver. So just get in contact with me and we'll find some time. Yes. So once again, Andrew, thank you so much for joining us today.
Thank you very much.